Hi guys, welcome back to my channel. Today we'll be talking about chronic kidney disease, what we call CKD. Okay, so what is chronic kidney disease? Chronic kidney disease, it's a series or a spectrum of pathophysiological processes of the kidney. It involves the decline in kidney functions as well as the glomerular filtration rate. Once there's a glomerular filtration rate decrease, you know that there is an issue with the kidney. The next we're talking about is the epidemiology. You know that chronic kidney disease is high in places that are still developing, especially Nigeria and India. And the major cause of chronic kidney disease in India is diabetes nephropathy. So there are various risk factors for chronic kidney disease. One of the risk factors is old age. As you advance in age, you know that your body system, the immune of your body system begins to decline. So there's possibility of developing chronic kidney disease. Another risk factor is history of kidney failure in your family over time till fourth generation. There is possibility of you developing kidney disease over time if you don't watch your lifestyle. If you don't watch your diet, your activities, you might come up with this disease. Another factor for chronic kidney disease is diabetes mellitus. Diabetes mellitus is another risk factor. When persons comes up with diabetes, they are prone to certain disease. It's also not what we call comorbid diseases. Another risk factor we'll be looking at is when a person have previous episodes of kidney diseases. If you have experienced kidney diseases over time, you see that you might become susceptible to kidney disease. We also have autoimmune diseases. Autoimmune diseases like systemic lupus erythematosus disease. We have other autoimmune diseases aside the lupus erythematosus disease that can make us susceptible to kidney disease. Remember that once there is a damage to a particular organ in the body, if it is not mitigated early, if it's not arrested, if it's not taken care of, there's possibility of other organs to begin towards fail, because each organ in the body has an interrelation with other organs. That is why an effect to one would surely affect others if it is not treated properly or on time. Unless we'll be looking at is causes of kidney disease. Now, there are different causes of chronic kidney disease. When it's chronic, it means it's long, it's been there for a long time, or it's not properly treated previously. Now, causes of kidney disease include primary glomerular diseases. These are diseases that affect the glomerulus. Remember, in the kidney, one of the structures of the kidney is the glomerulus. If you look, you'll notice that the kidney has the glomerulus, the urethra, the pelvis, the major and minor calyxes, the pyramids. It also contains blood vessels, which are the afferent and efferent arterioles, the Bowman's capsule. So these are structures of the kidney. Now, remember, when there is any primary glomerular disease like pyelonephritis or glomerular nephritis, which are the inflammation of the glomerulus, can lead to chronic kidney disease. Remember, the glomerulus helps in the filtration of urine, right? It helps in urine formation. So if there's any damage to the glomerulus, there will be issues with urine formation, which will affect the function of the kidney. Another cause is systemic disease. Diabetes mellitus, hypertension can cause kidney failure or disease.
Tell your friends.
Now, another factor we'll be looking at is vascular changes. Vascular changes such as the large vessel disease or the small vessel disease. Now, when we say large vessel disease, these are diseases that affect the bilateral artery. Now, when there's any issue with the bilateral renal artery, it has to do with the large vessel disease. Remember, in your kidney, you have the renal artery and the renal vein that enters into the kidney through the ileum, now which is a curved shape in your kidney. Now, if there's issue with your bilateral renal artery, then it's a large vessel disease. So it's one of the causes of chronic kidney disease. Now, if there is ischemic nephropathy and vasculitis, it's a small vessel disease, but it also affects the kidney function. Now, another thing we're looking at in this video, we're talking about objective causes like kidney stones, disease of the prostate, and urinary tract infections or diseases. Because what you remember I said, once there's an issue with one part of the body, it can result to other issues. So it grows from one. From which get to chronic kidney disease, meaning it has passed the acute stage. So probably someone that has kidney stones, person that has prostate disease, somebody that have urinary tract infection can come up with chronic kidney disease. So guys, talking about the signs and symptoms. Signs and symptoms of chronic kidney disease involves one, it affects the neurological function of the body. You see the person having slurred speech. The person to like to not be able to speak properly or coherently. Now, we also have increased muscle fatigue. There will be slurred speech. There will be lack of concentration or disorientation. There will also be seizures or hysteresis. There will be seizures, hysteresis, disorientation, confusion, increased muscle fatigue if it affects the neurological function of the body. If the kidney fails to remove the excess fluid in the body, it can result to edema in the hands, the feet, especially the lower extremities. If you want to know what edema is, don't forget to check in my previous video where I explain these terms. The metabolic system of the body, you're going to have weight loss, nocturnal urination, that is urinating at night. You have proteinuria, that's protein in your urine. You have hyperphosphatemia, which is high amount of phosphates in your blood. You can have hyperkalemia. Hyperkalemia can result in excess calcium in the blood. Hematologically, you can experience dizziness, difficulty concentrating, GIT, you experience constipation, you have difficulty in sleeping. You also experience this fishy or ammonia smell in your breath or in the person's breath. When the person speaks, the smell that comes out, the air that comes out would be having this fishy or ammonia smell. And if it affects the cardiovascular system, you can have hypertension, you can have palpitation, hypertension, you can have left ventricular hypertrophy, experience electrolyte imbalance. It affects the respiratory system. You experience what we call tachypnea. We also have what we call pulmonary edema. That's fluid in your pulmonary artery. You also have pleuritis. That's fluid in your lungs. And then you also have pulmonary edema. And you also have tachypnea if it affects your respiratory system. So guys, if you want to know about the pathophysiology, click in the next video. So just drop your message in the notification box and then see you in our next video. Bye.